Hello and welcome to our Kinepict Knowledge Base Podcast. I am Krisztián Szigeti, CEO, co-founder at Kinepict. Today we are happy to welcome Dr. Pierleone Lucatelli from Rome.
It's my pleasure to be involved in the collaboration with you all, guys. My name is Pierleone Lucatelli. I'm an interventional radiology staff consultant at Sapienza University in Rome. I am PhD, graduated, mainly involved in liver research field.
Please introduce briefly your institution. What is your major profile? What kind of intervention do you make most frequently?
My institution is Sapienza University of Rome. Is a major trauma center and a liver transplant center whose activity range around 3,000 procedures a year, mainly involved in liver intervention procedures.
How did you hear about the Kinepict technology, digital variance, and geography? How did you get in touch with Kinepict?
Actually, I studied a bit at the beginning, and then I get directly contacted by the Kinepict board in order to potentially develop a collaboration that straightforward bring us to a joint straightforward collaboration.
When did you start the research collaboration? Which topic?
Our joint collaboration developed together is mainly focused on liver chemoembolization procedure and date back to early 2021. And on the beginning, we tried to develop a novel application and to verify the quality of this software for one of the first peripheral body application.
What are the most important results so far?
Actually, and this study has also get awarded as a certificate of merit at last Embolotherapy Congress 2022. We were able to demonstrate a better lesion detection in course of chemoembolization procedure, as well as better lesion feeders visualization that's potentially impacting on chemoembolization performance. And finally, all external readers that review our dataset were happy to see better the tumor, that providing us better insight for the procedure itself.
What is the significance of this data, and what do you think the future of the liver chemoembolization?
Okay, I think that the strength of the results really relies in the quality of the software, because by aiding us in better visualizing the target area of treatment and better visualizing tumoral artery feeders, this may act as game changer in the field of chemoembolization procedure. In which sense? These patients are usually fragile. It means that they have several comorbidities, mainly liver insufficiency may be one of that issue. So potentially they could benefit dose reduction even for such application, and even contrast media reduction.
As mentioned, the lower limb intervention. What do you think? Where is the better importance of DVA, liver embolization or lower limb?
In my opinion, lower limb is really astonishing result in terms of better visualization, or which target should be revascularized, and how better the visualization is achieved. This is not for fun, in the field of liver embolization procedure, this is not for fun, because it really can give you aiding of better finishing your procedure and achieving a better complete response. Let's say the better you see, the easier the procedure. So whenever you have the chance to utilize a software that provides you better visualization, the easier will be your procedure and the better will be the treatment response of your patient.
Mm-hmm. Have you already published your data?
Actually, we are doing that together, and we are finalizing the first draft of the joint effort, externally reviewed by 5 external European reviewers, and we will be promptly start for several other prospective research.
And what is your general opinion about DVA?
Despite being a really young, let's say, technology, the really interesting part of such a brand, and not only a software, is a young and smart society built up of engineers and enthusiast doctors and physicians that are really proud of their product and really keen to develop really marvelous collaboration. So whenever you feel interested in developing a potential other collaboration, please do contact Kinepict, because they will sure support your ideas.
Thank you very much. But the Kinepict workstation has been installed at your cath lab. What kind of angiography system they use?
We are starting the installation, and I do have now an Artist Z Siemens ceiling mounted angio suite, and the strength of the software is mainly also that can be applied to all different vendors of angiographer. So will not impact whether which machine you are using in the routine practice. Maybe could be applied to every angiographer unit.
Mm-hmm. And what is your experience with the DVA in your daily work?
Actually, despite till now, our utilization was performed through retrospective analysis. I've seen that the data set elaboration is pretty fast, substantially comparable to those usually required for COMIM-CT advanced imaging, so no more than 20 seconds, and that could really provide much more detail for your procedure.
Mm-hmm. Are there ongoing studies with DVA?
Yes, we are trying to explore the potential dose reduction and contrast media administration reduction in course of embolic chemoembolization procedure, as well as potential correction of motion artifacts.
What do you think? So, why important the motion artifact in the liver embolization?
Actually, liver is of course, as nearly all solid organ, moves with the breath, and not all elderly patients are really able to support and sustain such an apnea time throughout the procedure. So not only for such an elective pathology and procedure is really recommended, but the main key potential application would be for emergency bleeding procedures, because such a patient are facing and struggling to be lying on your table supine in a good way, and this could be not really helping your procedure. They could have some problem in maintaining apnea throughout the procedure, and usually in such emergency scenario, it's hardly ever possible to perform a general anesthesia. So in this condition, a software that can provide us better arterial vasculature, visualization, correcting motion artifacts would be the near future.
As you mentioned, the next step, how could you use the DVA in clinical practice? Or what do you think? What could be make the next step in a collaboration?
For sure, having such a software in your Angio suite will give you the chance to experience the benefit of such advanced software imaging guidance. For sure, there will be major benefits for embolization procedure, but I do suspect that by having it spread across countries and across Angio suites, much more ideas will come out throughout experienced operator usage.
I would like to take the opportunity and thank you again for participating in our Kinepict Symposium at CIRS. Also, you have presented your data recently at several international meetings with great success. Could you talk about this achievement?
This achievement was reached after having worked nearly a couple of years together with Kinepict. As said, we retrospectively revised the performance of the Kinepict software on the chemoembolization procedure, regardless which was the target of treatment, either standard hepatocellular carcinoma, HCC, or even in course of metastatic colorectal cancer patient treatment that are known to be much more challenging in terms of visualization and treatment. On the basis of this, we built up a core data set to be externally validated by European expert on the field of chemoembolization procedure in order to have an external validation of whether the software could provide better performance in terms of lesion visualization, feeder detection as a general visualization score. This gave us the ability to quantify in terms of number disadvantages. All different evaluation performed demonstrated the benefit, regardless the reviewer, regarding the topology of pathology that was undergoing treatment. So in my opinion, if you are facing a software that provides you an advantages, regardless what you're doing, regardless who is seeing that, this is really a major benefit.
Finally, thank you for your detailed answer. I am afraid we have reached the end of today's session. Thank you all our listeners for joining us today. And big thank you to Dr. Pierleone Lucatelli from Rome, sharing her insight and wisdom with us. As always, if anyone has any question or comments about what we have discussed, be sure to get in touch with us. We're looking forward to catch you all next time. Bye.
Bye. Thank you.